The whole idea is for us to come in, spend some time with them, understand the community, and then help them to be able to take care of themselves, and then we leave. So it's about setting up that system that works.
Hello, everyone. Welcome to another episode of Living African Podcast. I'm your host, Anya Fombad, and I have here with me Dr. Clovis Sangwe. So, today I want us to really highlight an issue or at least a topic that is very close to my heart, especially as a health professional from Africa. This is with respect to healthcare access in our continent of Africa. If you're African and or if you have grown up in Africa, you will definitely know that there are so many areas in Africa that have a lack of access to healthcare resources or even services. But there's one doctor who's Dr. Clovis Sangwe, who has taken the initiative to actually do something about this problem in his community. And that's why I really wanted him to come on here for us to discuss this organization that he created, which is Rural Doctors, which provides healthcare access to remote communities in Cameroon, West Africa. So I want to welcome you here, Dr. Sangwe. How are you doing today?
Great. Thank you for having me.
Thank you so much. And it's a pleasure having you as well. I really appreciate you taking that time to come on here and share your knowledge and expertise with our audience. So let's just get straight into it. Who's Dr. Sangwe?
Dr. Sangwe is a public health physician. I'm very passionate about issues around healthcare access, disease control, or community based health system strengthening, especially in conflict, fragile setting, rural areas, especially where you either do not have health facilities or access to the nearest health facilities is quite a problem. So, yeah.
Right, right. Thank you so much for sharing that information with us. Now, so what really made you to create this organization?
It's a combination of a lot of things. I am someone living with an NCD, asthma. So, growing up in a rural community in Cameroon, we had this challenge of having access to, at that time, it was aminophylline. That's what I was treated on. So, for my
Hmm.
mom to get that drug, it required traveling to Bamenda, which is several kilometers from the where we were living. That
Yeah.
was quite stressful for her because it meant when I have crisis, maybe at night and I'm out of meds, she'll have to figure out how to move from DOP at night with a child that is barely breathing to Bamenda. I mean, this alone inspired me in some way to be able to figure out how to contribute in my own little way to improve how people access medications, because it was hard for me to understand why living in a rural setting such as that prevents you from having access to healthcare,
Yeah.
whereas you have others living maybe in cities and so on, and they don't have this challenge. This is my own personal experience, but as a
Experience. Yeah.
medical doctor, yeah, as a medical doctor, I had the first station where I was sent to was a different ball game. It was not the kind of regular community which I've seen. Yes, I've seen rural communities, but the challenges here was quite different. I share a simple experience where a bleeding lady, she was pregnant, she was in her third trimester. She started bleeding the previous day, but the problem was to get to the health facility. Since she has to, board a boat to the health facility, the boat only
Mm.
comes once, and she was already late, so she had to wait. Despite the fact that she's bleeding, she had to wait the next day, and then got to a fisherman to
Oh
transport
no.
her. So she came into the hospital. I mean, she was pale, she was going, and then there was
Yeah.
fetal distress and everything. And we needed to do a cesarean section. But we are talking about a health facility that has no electricity.
Oh my
Yes, at least
gosh.
there was a theater set up, but there's really nothing, no anesthesia, and so on and so forth. So, how do you make,
Oh.
this kind of decision? I will not want to go into details of how we came out of this alive, but
Oh my
just
God.
just to highlight that this was a heavy experience for me. And from that day, I decided instead of waiting for these people, I will go to them. So I started out by going to these communities with a portable ultrasound machine and some drugs and meds as much as I could afford. And then I had to do this free because that
Yeah.
was the only way I could also give them a reason to see that this is actually useful. You know, if
Yeah.
I were to put a price tag on this, then I may end up not serving the purpose. So
Yeah.
I started doing that. Then I had a couple of I don't know whether I should call it backlash from colleagues, which according to them it was unbelievable that I will go to live in those kind of places and instead of hustling in quotes like some of my colleagues in town. So because of that, I decided to brand myself. And the whole idea was to inspire young care providers to know that practice in such a place, yes, it's harsh, it's tough, but it's an experience on its own. It's very satisfying each time
Yeah.
you're able to save that single life. So to convince them, I had to brand myself, calling myself the rural doctor, and then there was the whole logo thing. I'd take pictures of myself going there, put it online, share, stories and so on. And it started kind of inspiring people because you have a colleague, say, I'm a rural doctor, people started seeing it like a thing of pride. Like I could just say I'm a rural doctor and people are proud of what I'm doing. So it
Yeah.
created this kind of movement. So with time I realized that okay, here I probably need to make it an organization if I really want this to be sustainable. So that's how we got to where we are today.
Wow, that's so impressive. When you shared this story, it just reminded me of the work my mom also was doing in the community. Growing up in Cameroon, we lived in a relatively rural area, and that was just because my dad was a researcher, so he had to be in that place to carry out the responsibilities of his job. So of course we had to tag along, but my mom was the only medical doctor in the entire community. So you have an entire community depending on her. Like I remember we used to wake up, like people used to knock at our doors like 4 a.m. in the morning or whenever at night just to get help or a quick consultation from my mom, who actually took it upon herself to just, provide healthcare resources like medications for free just to help the community. And then for serious cases, sometimes she found herself actually driving them to the hospital because she was one of the few people in the community that had a car. So when you look back, and this was in the 90s, when you look back now and you see how advanced life has become, how progressive things have become, it just gives you the opportunity to appreciate the work that doctors or even anybody in the community is doing or are doing to actually help people in the community to provide access one way or the other. It also reminds us that we shouldn't forget that despite the technological advancements, despite the progression that is seems to be global, we should not forget the fact that there are actually still people that need these resources. There are actually people who have to walk miles, tens of miles, just to get basic access to healthcare. So I just want to thank you for coming up with that initiative. Now, what is your demographic? Like, what services do you offer? Are you focused only on women? Are you focused on men? Or like, what specifically is the demographic?
Yeah, it's a great question. Where you have limited resources, it's best to prioritize a population that are most at risk. And
Yeah,
here we mostly work on mother and child health, and then you have the elderly. And somehow it's true, it creates a kind of ripple effect, and sometimes others tend to benefit from the system that we do set up. But primarily, we look at pregnant women, and then you have children under five, and then you have women, and then you have men. The other
elderly.
population somehow they can figure out,
Yeah,
how to get to
that's
town. But
true.
a pregnant woman, like the story I told you about,
Yeah,
I mean, she's helpless. Yeah. So
yeah. Oh, that's good. So, what are a few achievements that you guys have had so far, like in terms of impact?
This is a good question. To me, the most impactful thing that we've achieved has been to inspire people. That's the
Right.
most, because then we were able to see everyone trying to do their little best. I mean, we have a database of volunteers that are, I think, about between 80 to 100 volunteers. These are people that are
Mm-hmm.
not paid. They just say, okay, I'm available next week if there is anything, or if you have any program or finances to go to any community and you think I can come in to help. I'm happy to offer 5 hours next week, to
Yeah.
help. I mean, this alone, it's to us, it's far bigger than, even the community impact itself, because just being able to convince others that yes, we were able to set up this kind of system where people sit, they think about remote communities, they design sustainable ways of helping, and they actively participate, it's enough. But talking now about community impact itself, during the period of, when the crisis was really, not saying that it has slowed down, I mean, the political crisis in the English speaking part of Cameroon is still ongoing. But at this
Mm-hmm.
period, it was still, I consider it a hot period, because it was something people least expected. So you had massive movement of people, displacement, and so on. So during that time, we helped a lot, especially with those that were displaced into the West region and some parts of the littoral, supporting with their care and so on and so forth. And but when it comes to setting up a system that works to a certain extent, we have done that in one of the most remote communities which we've ever worked in, which is in Manoka Health District. This is in the littoral region, where
Right.
you spend about 3 hours in a boat to get to this community. It's one
Wow.
of the biggest islands in Cameroon. There we've tried to set up a kind of system where they rely more on healthcare workers, not healthcare workers, but community health workers, to be
Mm-hmm.
able to serve the community health workers, serve somewhat like a link between the community and the district health facility, which is quite far. So we've been able to do that. I think this was sponsored by the French Embassy in Cameroon and the Pierce Foundation in Israel, such that
Mm-hmm.
we carried out an action research to prove that where we don't have a health facility, we can use this and we should be able to save some lives. So those are the things I would consider as heavy impact.
Right. Thank you so much. Now, with the organization, what community did you start with, and how far has your outreach gone?
We started because first it was a one man team. So I was
Mm-hmm.
alone doing everything. And at that time, I was a medical officer in Manuka Health District.
And where is that?
That's in Littoral region.
Okay.
Yeah, that's in the Littoral region of it's Douala 6 subdivision. So
Mm-hmm.
there, that's where I learned that you had really tough or harsh, hard to reach communities as such. It was very difficult to work there, and I had to make, my time there worthwhile
Yeah.
by serving the population, going to these communities and so on. So when I started the organization, that was like the pilot, community which we're serving in, because we believe that if we're able to set up any system that works in that community, then it should be able to work in other places, because it's not just remote, it also has immigrants. So you
Mm-hmm.
have almost 70% of the population is made of immigrants, especially from Nigeria, and they are quite mobile. So it's difficult to really plan something and then it works out exactly the way you want it. So we believe that if we're able to implement our system of, empowering the community to be able to collaborate with healthcare workers to help themselves,
Yeah.
then we should be able to replicate that easily in other communities or other settings.
Sure, sure. Thank you so much for sharing that. It gives us a lot of insight. Now, from my own experience with organizations, I want us to really talk about organizations in Cameroon, especially the non-for-profit organizations. And this is solely based on my experience or from watching my loved ones trying to create organizations. There are a couple of hurdles, and not necessarily from the system per se, but I just want you to further elaborate and give your own perspective, especially when it has to do with getting things like sponsorships or even just creating the organization as a whole, because I feel like that's one thing that is a major hurdle, especially for people in the diaspora who are trying to create organizations to have an impact in our community in Africa. And then also another thing I wanted to talk about was just the reception of the services. And that's something for another day because I've experienced that personally when we were trying to do some work through our organization, and that was to provide healthcare resources to the community. So we can talk about that later, but I wanted us to really talk about ways that organizations or potential organizations could take advantage of to seek for like sponsorship or at least grants or support for the work that they're doing, on the ground.
That's a great question. There's something I always tell my team members. No one really cares what you do, but people care why you do it and how you go about it. That's the first thing. So if you at the diaspora, you decide to offer healthcare, to the entire Cameroon for the next 10 years, nobody gives a damn. Nobody
Mm-hmm.
will care to even offer their resources for it. But then, if people understand why you're doing this and
Yeah.
they align with it, they may be willing to put in their resources, to support what you're doing. That said, functioning in a country like Cameroon is very tough. It's
Yeah.
very, very tough. There is a lot of trust issues between, especially individual donors and organizations implementing. There is a lot of issues around how you sustain yourself while running the organization and so on. And that's why I, for one, I don't work full time for rural doctors. I serve now as the board president. This gives me that leverage to be
Yeah.
able to properly coordinate without having any interests when it comes to funds or anything that comes in. It makes it easier to manage the organization, and then also seeing that I myself donate to the organization, it pulls a lot of trust in that direction. But then that's just a part of it. Functioning, there are a lot of challenges, like you go into a community, you need authorization maybe from a district, or at least inform them so they know, okay, this is what you're doing, you're offering health services, or this is the project you're running. And people begin to make demands on what you don't even have. Like for instance, the first 2 years of functioning, we did not have funding from anywhere. It was just myself and some friends and well wishers, and especially my Twitter followers. I had a couple of Twitter network or connection at that time with a lot of Nigerians supporting, especially those in
Wow.
the diaspora. Those are the people that made me believe I was actually doing it right, and I could push and insist on it till I could get the different level of support that got to this level. Yes, so functioning in Cameroon, first, just thinking about it, you need to be sure why you really want to do it. Learn how to communicate and talk about it. Allow it to be open, because the challenge that we have is organizations are closed. Like, it's so difficult to partner with another local organization. It's like
Yeah.
we are fighting over a niche. We have already, created a kind of system in this community, or a culture rather, where they don't consider healthcare a priority. This is not any fault of theirs. It's not a problem of trust entirely. Yes, there are instances where you have issues of trust, especially during crises. They want to know if you are representing, one party or the other, and so on. But in general, the problem is you have communities where they have a completely different priority that is not aligned with the work that you're doing.
Mm-hmm.
They consider that, okay, we have children that die from malaria, so if you come to offer care for malaria, they will listen to you because they
Yes.
know that one. Now you also have you coming in and talking about NCTs, whereas they feel that you should be bringing food because they are hungry.
Hmm.
Communities over time, they build their own priorities, so they've been malnourished, they've had issues, meeting doctors, they've not had the opportunity to see specialists and things like that. Somehow they found a way to adapt. They now believe more in roadside vendors. They see herbalists, because they're always there to provide them these services. Now, when you leave from outside to come to them, the only chance of you succeeding is planning that project with them. So it means that you need to do, which is an approach which rural doctors have adapted in recent times, because at first we're just focused on offering these services. And we realize that in some communities, the problem is not even the money. It's not a problem about it being free. It's a problem of either the access issue,
Yeah.
that has made them to develop their culture of doing things. And then you're bringing in something completely strange and they just cannot understand what you're saying.
Mm-hmm.
So that was principally the issue. And now what we do is we do a kind of assessment. We identify one or two things that they consider as priority to them. And then we do more of an integrative approach. So if I want to run an NCD program and I feel that these people may not consider this a priority, they may not be interested in it, I may have to include another thing in this package which they're interested in. It could be under five consultation,
Yeah.
because most of these communities, when it has to do with children, malaria, and so on, they easily accept.
Yeah.
If you are able to put an integrative package and say, okay, as we are going to this community, we'll do consultation and help children under five, and at the same time, we offer SCG care services, you may end up having the community at line. So it's a question of the culture that helped them to build over time. There is an interesting experience that we had. I moved in for the first time with a team into a village called Cap Cameroon. It's an island. So when we got there, I told them about, their habit of, they don't have wash facilities. So they just have something built for privacy. But each time they defecate, it's actually dropped directly on earth,
Hmm.
right? And then what happens is when the sea level rises and they have
Oh.
dunar floods, yeah, when they have those dunar floods that they normally have, it washes this off. This is their toilet.
Oh.
So when we got there, I explained this phenomenon to the team that came to work with me, and they were like, "No, but how can they do that? This is not right. This is not correct." So they had their meals and so on, and then in the evening they needed to ease themselves, and unfortunately for them, there is actually no toilet. So now they had to leave that reality of
Mm.
the population. So it's usually easy for us to judge, to sit from outside and say, why can't these people get it? Why can't they accept vaccination? Why can't they accept free services? But when you put yourself in their shoes,
Yeah.
when you understand that we contributed in setting up what we now call culture, because each time we
Yeah.
say, no, these people have a culture of not accepting injections, not accepting this, it is something that happened, which we all contributed in building. They developed their own way of coping, and then we are coming in with something they are no longer used to. And so to succeed, we must spend time with them, educate them, build the programs together with them before we can successfully implement. And that's why with rural doctors, we now do more of community-based health system strengthening,
Mm-hmm.
which is not focused on going to give free health
Yeah.
services. No, we only do that in case of crisis or things like that now. But the focus is working with them to build that system. It's true that in course of building it, we may end up offering free. It's true, but the entire thing is to help them to be able to, understand why this is necessary in the first place,
Yeah. To
and then
sensitize
collaborate
them.
with the local staff. Exactly.
Yes, yes,
Yeah.
yes. Thank you so much for sharing that perspective. That's definitely an insight that I really did not appreciate before. I didn't really recognize before because it's very easy to sit from outside and be like, hey, this is what you need. This is what you need. This is what you need. But it's like giving a cow meat to eat, like you're not giving them grass. The cow needs grass because that's what it eats, but you're giving it meat.
Yeah.
So it's very
Yeah.
important
At
to
least all
have.
of us experienced that with COVID-19, right?
Right, right.
I
It's
mean, with the COVID-19 vaccines, I mean,
yeah,
when it was imposed, we were told that this is important, but we had healthcare providers that fled. Why were they,
yeah,
running away from the whole thing?
yeah,
It was something they were no longer used to, because they know that vaccines takes years to
yes,
develop. And so something new was introduced,
Yeah.
and that's why there was
Those
resistance. So
resistance.
it's the
Yeah.
same thing with these communities. Yeah,
Yeah, that's very true because, yeah, that emotional intelligence and that empathy, that level of empathy is very important, especially when it comes to making such decisions and carrying out different projects to address the true needs of the people and not the needs that we think they have. So,
that's
yeah,
right.
that's such a great insight. Thank you so much for sharing that. Now, let's switch it up a little bit. Can you tell us like some of the crazy experiences that you've had, going to all of these remote places? I know you just told us about the reason why you started to begin with after having that tragic experience with the lady whose life was fortunately saved. I would imagine that you must have had some crazy experiences, especially in your mission out there in those remote areas. So, can you share some of those with us?
Yes, there are, a couple of experiences. There is not just health, there's also the social.
Mm-hmm.
Of course, it has health implications anyway, so I'll just share that. The first time I went to, Steel Manoka, I stopped by for a drink. That was in the evening, and I was served by a bunch of kids, 8 and 7 years old. I had to even share the bar with students from school. I'm talking about children of about 12 years, 13 years,
Mm.
and so on. I mean, they ordered beer. So I was actually in,
What? Wait, what? They
in
ordered
culture shock.
alcohol?
Yeah, alcohol. They
Whoa.
ordered alcohol. They were just back from school, and I think they felt like they needed to put away some of that stress. So they passed by to grab a bottle of beer. I was in culture shock. I mean, just
Whoa.
seeing that. Yeah. And then the interesting part is nobody really sees anything wrong with it. I was the strange one. So it's one of the crazy experiences I've had to witness. Then talking about Cap Cameroon as well.
What's that?
Cap Cameroon, it's also an islet there in still in Manoka district.
Mm.
The way of living, the way they construct their building, there they witness real impact of climate change. So what happens is when you have those high tides and floods, sometimes it's so heavy that they probably need to plan and transfer their houses. And the way they build or they construct their houses, it's usually small size and made of wood, and it's quite easy to carry. Well, not easy, but they get the community to carry. So I happened to witness how they carry one of the houses to transfer to another location.
Mm.
So
Wow.
it was really a sight to see. And even of recent, the health facility, which I was part of a project that set up a health facility for them, and because of the flood and the erosion, the building got destroyed, and we had to transfer. Had to leverage that interesting experience, getting them to cut the health facility into several pieces, and then
Oh.
you have the community carrying. I have some interesting videos on that carrying it. So
Oh, wow.
it's just a handful working in these places. You learn a lot from them. The biggest error one can make is to begin to judge without understanding,
Understanding, yeah.
why these things are happening, in the first place.
Yeah,
Yeah.
wow. Yeah, that's very true. Thank you. So, in terms of like basically the work that you do, right? Like, can you share with us some cases that you had to address that actually stood out to you?
Yeah. The first case which I'll always remember is the one I did share.
Mm-hmm.
Yeah, the lady. And what made it really satisfying is the fact that that life was saved.
Yes.
The second, still with pregnant women, during one of my missions with, the portable ultrasound and so on, she was very aware of the need to continue her antenatal care, which is something which is not really like part of their culture, if we can put it that way,
Yeah.
because they don't have access to it. So she followed that up and everything. And with the ultrasound services that I was offering, we were able to see that, okay, there was a complication of a low line placenta requiring a surgery. And because she was not yet in labor, we actually planned and worked together. I called colleagues in town. Everything was well organized. And then she was transferred, operated upon, delivered. we really expect. So things like that, experiences which they are quite hard for me to forget.
Yeah.
Also, there are others which I'm happy we were able to help, but the stories are not, they are not also very good. Like a lady that fled from the crisis and she was pregnant. She came into town. I think it was Douala, yeah,
Mm-hmm.
and she had to spend a couple of nights in a motor park,
Oh.
referred them to a family, but I think she was not in luck, so she spent a couple of nights at the park. Unfortunately for her, someone was raping her and stuff like that in that pregnant state. And even in the end, the person which she finally got help from, it was still the same problem, because it's like she was lodged in a hotel temporarily, to do some work to be able to survive. But then the, I don't know if it's the cleaner, locked her up in one of the rooms and was also raping her. So it's just,
Yeah.
it's even telling, the complete story. But what is important here is that there are people out there that are willing to help these kind of people. So when we got this, we were looking at someone that did not just need healthcare. There was a psychological part.
Yes.
We needed to provide lodging. You needed to plan for the delivery of this child and so on.
Yeah.
So I was quite fortunate that people were willing to listen, because first of all, to protect this lady's identity, I did not allow people to meet her. We never used her name, not even once, and so on. But for some few that insisted and the lady permitted, they could actually meet her. So we succeeded to provide a place for her. Like someone comes and opts to provide a place, some will provide a cooker, some provide a TV set, and so on. And then another group even offered to open up a petty business for her. And then our partner hospital worked to follow her up till delivery. So those are some of the cases which, when we really think about the impact we've created in their lives, we think that we are doing it right,
Yes.
and we should continue to inspire and encourage others to do the same. It is not about the number.
Yeah.
We have the number. It's true, we have the number, but we have the number because of the number of years we've had to put in.
Yeah.
But I don't think what matters is the number. What matters is the lives that we're able to save, transform, the number of people we're able to inspire to think that this is relevant, to think that there is something that they can offer. In rural doctors, we don't have just doctors.
Mm-hmm.
The name rural doctors is just a name that comes with it. But you also have journalists, people that decide that, okay, what we want to do is to share the story about what is going on in this community and then get people to help,
Yeah.
you know.
Yeah.
Yeah, so those are some of the interesting experiences I've had so far.
Yeah. So, based on everything that you've said, there are a couple of things that stand out to me, but what most stands out to me, and what actually I really wanted to point out as well, is that, the work that you do through your organization makes me realize that there are actually good people out there. There are actually
Yeah.
way more good people than bad people out there. There are people
Yeah.
who are always willing to help. There are people who have good hearts, who have big hearts, and always willing to help. But what actually needs to happen is that sometimes we have to ask for this help. And sometimes it would not take one ask to get the help, but just letting people know that there's this desperate need of this community, or there's this desperate need of my organization to do this for this person. You will be surprised at the number of people who would reach out with a helping hand. I just wanted to call that out and also encourage us as a community to keep helping, to never stop helping one another. Sometimes you don't even have to wait for someone to ask you to help, but just offering and just having that open heart to always be willing to help is extremely important, especially in our community. That brings me to my next point, because I've always wondered, like, does rural doctors, like, does it have a network? Because sometimes I think about, these people in the remote areas, right? Remember I told you, like, my mom, sometimes she found herself driving certain emergencies to her hospital where she worked. Now, do you guys have like a network of institutions, or at least a network of doctors in different hospitals that you guys collaborate with when, let's say, there's an emergency, for example, or there's a referral? Do you have these institutions or these healthcare professionals that are maybe contracted, for lack of a better word, with you guys, so that you can easily have access to them and refer the patients over to them?
Right. I What we do is there is no project that we carry out without involving the district health service. The district health service controls the public hospitals and facilities in every given subdivision or district. So we always collaborate with them. One of the reasons is it's not that we have preference for public hospitals per se, because we've also worked with some private hospitals, but the issue is our approach and the way we connect with communities, focusing more on community-based interventions. Sometimes it's more or less novel. So to be careful such that we don't become too disruptive in our approach, we always align with this already existing government structure, which means if we are working in this village, we try to collaborate with the nearest hospital such that if there is need for referrals or anything like that, we directly link with them. So before going into the field, we already have the contacts, we have our protocol on how to move this patient and so on and so forth. But it's quite an interesting question you asked, because of recent we've developed a first aid manual, because like I said, rural doctors, despite having all this network of healthcare workers in different hospitals in different locations in Cameroon, the idea is not for the community to depend solely on this network, or to have to wait for rural doctors to have resources for them to receive the care that they need.
Mm-hmm.
The whole idea is for us to come in, spend some time with them, understand the community, and then help them to be able to take care of themselves, and then we leave.
Okay.
So it's about setting up that system that works. So of recent, we've realized that the community health workers, bike riders, community leaders, they need more empowerment in terms of first aid. A lot of people die because of that time lapse
Yes.
between I have a cardiac arrest and I got to the hospital. That is where the problem is. We understand that they don't have, the equipments and so on. But we also understand that there is basic first aid, which, when carried out, some of these lives can be prolonged. Even in transporting a patient, I mean, if there's a road traffic accident, the way you transport a patient can determine whether the patient will survive or not. So we have a first aid booklet which we've created, we've developed, we've not yet published it yet, but probably this month, or I think by the end of this month. We want to use this booklet to give to, these communities, train them on how to use it, train them on how to refer properly, and then create a link between them and the nearest health facility. It could be by providing, that cell phone at the health facility and giving that phone number to the bike riders and
Yeah.
the community health workers, such that when they offer that first aid, they have to call and say, this is the case, and we've arranged for a bike or something. That's what we're trying to do to fix that issue, or to enhance at least the work that the network we have, it's working.
Well, thank you so much for sharing that. You guys, of course, as the audience should have recognized by now, have done so much for our community. And on behalf of the audience, I hope I just want to, appreciate the work that you're doing through Rural Doctors. Now, how can people reach out to you if they want to support, if they want to ask any questions or get any information from you? How can they reach out to you?
Okay, we have a website, www.ruraldoctors.org. Rural Doctors is hyphenated, and I'm also very active on social media. We also have our pages on social media, Rural Doctors and Sandwich Clovis on the platforms.
Mm-hmm.
The On Twitter, I'm commonly called the Rural Doctor, and that is also my handle. So you could reach out directly to us from there. Yeah.
Okay. Thank you so much. And what are your last words to encourage and empower our communities to make a difference, especially when it has to do with providing healthcare access?
The right time to start, it's always when you think about it. There is never a time you can really say you're ready to do anything to help any community. Think about your idea, accept that yes, this is why I want to do this. If you have a good reason for doing this, build on a team. If people are able to align with what you're doing, one or two persons is sufficient. You don't need the whole crowd to start with. Do it yourself to demonstrate that this works. Endure. Donate to your own idea. Because when people see that you are able to make that kind of commitment to push on your idea, they begin to support.
Yeah.
Don't count on the people that you already know. Don't even count on, I don't want to say, but don't count on the people that you already know.
Right.
If possible, count on, people completely even out of your country, those out there. People want to hear your story. If it is possible for you to put out your story, I don't know whether it's using images, words, videos. People want to understand how genuine you are, why you are doing what you're doing. Nobody really cares about the figures.
That's true.
Just put it out there, link up with people. Don't be afraid to share your ideas. Don't think that someone will steal your ideas. Even if people borrow, your idea, they will never do it as good as you're doing it.
Yeah.
But at the same time, before sharing that idea, close up those gaps that makes you vulnerable,
True.
that makes you have those strange expectations of, okay, because I told this person this thing, this person owes me this. And if you're able to close up all these gaps, just get it done. There's never a right time to start.
Thank you so much. I felt like you were talking to me too. I really needed to hear that. You always need that reminder every now and then. But I
Yeah.
definitely and greatly appreciate the work you have done and you taking the time to come and share with us some of the work that you have done. I just wish you the best. I hope that we can get to partner in the future to do even more bigger and better things. Hopefully.
I'm always open.
Right, right,
Always.
right. It was definitely a pleasure, having this conversation with you. I can only wish you the best, and I hope to link up again with you and have this conversation going. So I'll catch you in the next episode. Bye.